There has been much in the news today about GLP-1 medications and yet another side effect. This time, some outlets claiming that GLP-1 medications cause pancreatic cancer. That cannot be further from the truth. In fact, peer-reviewed clinical studies that are available on legitimate outlets like PubMed have clearly debunked the fact that GLP-1 medications pose any pancreatic risk. In fact, GLP-1 medications began as anti-hyperglycemics, meaning they're used for the treatment of another pancreatic disease that we call diabetes. So this leads to a broader conversation that I think we should all have together. And that is, how do we debunk GLP-1 misinformation and disinformation? The key is in the study design. Anytime you read an article about GLP-1 side effects, find out the clinical study that the article is referencing. If there is no clinical study, it's likely coming from anecdotal evidence, a fancy way of saying somebody experienced it and now they're talking about it. It doesn't necessarily mean that that side effect or that risk factor is generalizable for all patient populations. It's simply something that happened, that a person experienced, and they're calling it out. That's anecdotal evidence. And it is considered the weakest form of evidence. Not to say that what you experience is irrelevant, it's just that it's not standardizable to the point where you can say that is a common side effect or that is a side effect that somebody can anticipate. So the key thing, if there is a source, is to then look at what is that source. If it's a clinical study, the key thing is to look at how that clinical study was designed. Now, many clinical studies, as the pandemic has taught us, come from clinical study methods that are less than fully objective. Case in point, observational studies. These are studies in which you study one factor relative to another factor over a period of time and just observe how closely they relate. For example, population density, likelihood of getting a COVID infection. During the pandemic, these observational studies were correlated with spatial density to then recommend or not recommend the use of face masks. Now, depending on how long the study went, depending on the population that was studied, it would show that, hey, clinical masks are relevant. Hey, clinical masks are irrelevant. The reality of the situation is that face masks were context specific, meaning the actual value of the mask depended on the context of the situation. Close population, high density, maybe the masks are more relevant than not. That's the weakness in observational studies. It's only as good as the factors that are observed as it pertains to you and I. How well does that observation relate to us determines how well that clinical study is relevant to us. And that's why a lot of these GLP-1 studies that talk about these purported side effects, psychiatric conditions, suicide risk, are observational in nature, meaning that they're not truly generalizable to the entire population of patients taking GLP-1s because they're only relevant to that observation sample size. It's very important that we recognize how to determine the nature of the study and what factors were observed. So what I would recommend is the next time you see a article on GLP-1 medications and its side effects, look at the clinical study behind it. Scroll all the way down to the method section. And if you see anywhere in there about two cohorts, meaning two sample sizes that are then observed together over time or somehow cross-correlated over a certain period of time, that's an observational study. And then you have to ask yourself, how did they derive those observations? That will tell you whether the study is relevant to you or not relevant to you. And that is a factor that we all should take into account as we become more self-empowered in our healthcare experience. Our symptoms are a reflection of the clinical conditions that we present with. When we explain those symptoms, we're talking to a person, a physician, another patient, who has to essentially internalize what you're explaining and then try to understand whether those symptoms are relevant to him and her, and that based upon that internalization can relate or not relate to what you're explaining. In the same vein, when you read an observational study, identify if that population that is being studied is in any way relevant to you or relevant to how you take GLP-1 medications, how you experience GLP-1 medications, and determine if that study truly has merit and whether the side effects that are purported are side effects that you should be concerned with. Now, this is not to be dismissive of clinical studies, because observational studies are a powerful tool and have been used for decades to help improve the quality of care for millions upon millions of patients. Observational studies have value. But just because something has value doesn't mean that it has value in absolute terms. It has value in relative terms. Meaning, the side effects that a GLP-1 observational study can present with may not be relatively concerning to you, even though it was in that observational study. So, key points that we need to look out for when we're looking at GLP-1 articles. Look at whether there was a study underlying the claims made in that article. If there was no study, it's likely anecdotal evidence, meaning somebody experienced it and somebody's explaining it to you. If there is an underlying clinical study, find out from the methods section of the clinical study if it was an observational study or not, and most likely all of these GLP-1 studies are observational in nature, because to do a truly double-blinded randomized clinical study is nearly impossible for all the side effects and symptoms that patients with GLP-1 medications are experiencing with. And trust me, with the growth of GLP-1s, the growth in clinical studies surrounding these are always observational in nature. You see this whenever there is a spike in clinical study improvement, like there was during the pandemic with COVID, with the COVID vaccines. The fastest clinical study design is an observational study. So more likely than not, the articles that you are reading come from clinical studies that are observational in nature, and you need to study how those observational cohorts, meaning how the data sets, the observations that are compared to one another in that clinical study, are being designed, because that is critical to determining whether that is relevant to you. If you have any questions, or if you have any specific clinical studies that you would like me to review or that you would like to discuss, I'm more than happy to do so. Just comment that you would like to discuss a specific clinical study, and I will do my best to respond in a timely manner.